Haglund deformity, what is it and how do we treat it as conservative practitioners? There are two main reasons someone's going to have a Haglund deformity. The number one is the most common reason, is an intrinsic factor. It's unresolved Achilles tendinopathy. We're going to talk about that in a minute. First, I want to cover the secondary cause of Haglund deformity, which is a problem with the big toe. And I've got the perfect patient for you. Here's a patient with a chronic issue with the first ray, has had a turf toe, and now he has a bunion formation limiting the range of motion of his first toe. When he loads that first ray, he needs 70 degrees of dorsiflexion. He gets 5, maybe 10 degrees of dorsiflexion. That's not enough. So when he goes to walk, what's going to happen is he takes in through stance phase, through the push-off phase, he needs 70 degrees of range of motion. He can't get it. He's going to twist his foot. That twisting motion can also cause issues with the Achilles tendon, but for the sake of this talk, it causes friction at the heel. That friction causes a callus and subsequent Haglund deformity. One thing you can do in your office as a cheap way to check can someone benefit from orthotic is using a first ray cutout. So you measure the area behind the toe, going up through the first ray, and now you create a space here. And let me explain why that space is so important. Because what you saw is when he loads his foot, he has very little to no dorsiflexion. However, if I can plantar flex this first ray by elevating the second through fifth and let that plantar flex, now what you'll see is he has better range of motion. So I can increase his dorsiflexion 20 to 30 degrees just by using a first ray cutout. Now this is a test. If this would help him, then I would send him to a podorthist or send him to a podiatrist to have something more permanent fit in. However, that's something that can help him in his sport. If he's going to Disney World with his family, those are kind of things that can help lead him into a direction for long-term care. In this case, probably more of an orthotic device. Now, the other reason someone may have a Haglund deformity is Achilles tendinopathy. If that's been there and it's been unresolved for a long period of time, unfortunately, that tendinopathy goes to heal, then goes to heal, then goes to heal, and no one ever fixes it. It starts to create calcification there and that subsequent bump that you see on the back part of the heel. So don't just calm things down when you're treating something, especially in the tendinopathy world. Make sure you build things back up. I provided some exercise in the blog to help take that tissue and build some resilience and strengthen it so that Haglund deformity does not get any bigger. There are surgical considerations that the thing is big enough, but these are two of the most common things that I use in my practice that help my patients get out of pain.